much differently in our province. So with each passing day and no new confirmed cases, it is natural to feel an increased sense of safety to resume regular routines. However, we must not become complacent, and we must continue to practice those prevention measures that we've come to know so well. So please continue to stay at home as much as possible, especially if you're unwell. Cover your coughs and sneezes, practice good hand hygiene, maintain a safe physical distance of at least 2 arms lengths from others when in public spaces, and wear non-medical masks when that's not possible. These practices have become embedded in our daily lives and will be vitally important to our protection against COVID-19 for the foreseeable future. The weather is warming and more people are going outside, so please remember the importance of physical distancing while enjoying outdoor public spaces such as walking trails and parks. I was heartened this weekend, while enjoying the outdoors myself, to see people diligently practicing safe physical distancing. This is the most effective prevention measure to stop the transmission of COVID-19. So please continue to give space to those outside your bubble and follow guidelines in these public outdoor places. Today, I would like to acknowledge that it is Paramedic Services Week and an important time to highlight the integral role paramedics in our province play on the front lines of our healthcare system, not just during this time of pandemic, but every day. As paramedics, you're often the first point of contact in any health emergency response and available day and night to provide expert medical assistance in times of crises. For your invaluable life-saving skills and expertise, dedication, and tireless efforts in helping and protecting our communities, please accept my heartfelt gratitude and appreciation. Thank you. As a recap for those who may have just joined, we have no new cases since yesterday's media advisory, and the total number remains at 260, with 242 cases in Eastern, 8 in Central, 4 in Western, and 6 in Labrador-Grenfell Health. When we look back at how far we've come over the last 2.5 months and the significant strides we have made against this pandemic, it's a good reminder to all of us of what we can achieve by combining our efforts to support and protect each other. And while the path forward may not always be easy, this shared purpose will see us through to better and brighter days ahead. So hold fast, Newfoundland and Labrador. Thank you.
Thank you once again, Dr. Fitzgerald, and good afternoon again, everyone. Well, what a great way to start a new week with a report of no new cases of COVID-19 in our province. 0, I think, like many of us, has become my favorite number during this pandemic. You know, I think since we were talking about numbers, I think it's just a reminder and update everyone that since May 4th of this year, we have had over 3,200 travel exemption applications, and all but 7% of those have been denied. So there are people moving with their travel plans coming into Newfoundland and Labrador with their travel exemptions in place. And over the last 24 hours, just a reminder of the great job that we've been doing at our borders. There's 169 people that have came into Newfoundland and Labrador. And that calculation, by the way, is taken from all the points of entry. So from time to time, we get, comments on social media about large numbers of people coming across our border. So just an example, this is an example. Over the last 24 hours, there's 169 people that have come in from all points of entry. And I think, as Dr. Fitzgerald has just said, this is a large part of the success that we've had within our province. So I want to express my thanks once again to Dr. Fitzgerald and our public health officials who have been working nonstop through this pandemic. I also recognize and thank you to the residents, as Dr. Fitzgerald has already said, for the great work that you are doing protecting yourself from the spread of this virus. But in doing so, you're also protecting others. It's the responsible measure that it keeps most of our vulnerable people and our essential workers safe. We must not forget that while most Newfoundlanders and Labradorians were staying at home during the initial stages of this pandemic, it's our essential workers who are our community heroes. Like our healthcare workers, they could be our truck drivers, our cleaners, our grocery store workers. They were indeed leaving their families every day to provide much needed essential services and goods for residents of our province. So we do not want to go back to those early days in this pandemic. I think 18 days straight at zero numbers back in April seemed something that we could not do in our province. But thank you, because you have stepped up and helping us getting us where we are today. But we must always remember that our results are proof that physical distancing and practicing good hygiene works. So while you've been hard at work to protect yourself, we've been at work putting in place supports and resources. Everything that we do and the things that we have done in the past is about protecting you. It's about supporting you as we work to stop the spread of COVID-19. Especially now is to move to alert level 3 in our plan, Life with COVID-19. This is a move that will take us a step closer to our new normal. As we look forward and towards alert level 3, we are putting further supports in place for residents and for industry to help ease the burden that this pandemic has placed on our province. All of the work that we do is about helping you during this global pandemic, and the goal to provide assistance for such things as paying bills and making sure that you have the basics in life. Throughout this pandemic, there has been considerable focus on how we would alleviate the stress that is placed on people and businesses. One of the most difficult and hardest sectors was the tourism and hospitality industry in Newfoundland and Labrador. Incidentally, this week marks National Tourism Week. Like most things, it looks quite different this year in 2020 than it did last year in 2019. But it shouldn't stop us from recognizing our industry that plays an important role throughout Newfoundland and Labrador. The tourism industry includes more than 2,700 businesses across our province. Of that, many of them are small operators spanning across some of the most magnificent rural and urban areas in Newfoundland and Labrador. Businesses in our province, they provide over 20,000 jobs. So the thing is local economies are energized by the tourism operators. They are key to sustaining many of our rural and small communities. So by supporting tourism, we are fostering economic development, which is critical to diversifying, growing, and strengthening our economy. So earlier this morning, myself and Minister Davis announced a $25 million investment through a tourism and hospitality support program. This is a provincial funded program that will make life a little easier during one of the toughest challenges that we have had to face together as a province. This program will provide eligible operators with support at a time and gives them an opportunity to get back on their feet. It will provide immediate financial relief to better position our tourism operators as they look forward to reopening. Many operators will benefit from this program. People like accommodations, people that are involved in tours, attractions, food and beverage businesses, outfitters, transportation groups, and retail operators in tourism. So a lot of questions we're getting so far about how it would work. If you're an eligible small and medium-sized business operator, you can apply for this one-time, it's non-repayable working capital contribution. So this is not a loan. This is something that when you meet the criteria, you will not have to pay back. For those of you that have gross sales of $100,000 or less, it's a $5,000 grant. And if your sales are over $100,000, it's a $10,000 contribution. So the date for you to apply will start on Monday, June 8th, and further details about this program, including the eligibility criteria, that will be posted on the Department of Tourism, Culture, Industry, and Innovation website in the coming days. So we all work together towards keeping COVID at bay as we continue to work and support residents and industries in our province. It's by working together that we will learn to live and work in what is a new normal. We must stick with our plan. We put a plan in place and we know that that plan is working. We must remain optimistic about reopening our economy and focus our attention on how we can best do it to support our businesses, which in turn supports the residents of our province. They are the job creators and some of the 20,000 that I just mentioned in the tourism sector. But we also must keep in mind that we have to do this safely, keeping in mind the burden that it places on our healthcare workers, those essential workers in our society that do not get a chance. If indeed we had to have another outbreak, they do not have a chance to go home and stay inside. They must continue to go to work to provide the services that we need as a province. So before I conclude my remarks today, I'm going to send a virtual bouquet to yet another group of hardworking Newfoundlanders and Labradorians. Dr. Fitzgerald had mentioned that this is Pandemic Services Week, but this is not only Tourism Week and Paramedic Services Week, this is about Early Childhood Educators Week as well. So this presents us with an opportunity to acknowledge the crucial role our early childhood educators play in the lives of our children. Their knowledge and their expertise guide and support their early learning and development through play-based learning and exploration. So they've been playing a key role through providing essential support for families during this pandemic. There are approximately in our province some 2,200 certified early childhood educators in communities throughout Newfoundland and Labrador. So on this week, we want to thank them for their dedication and their hard work. So whether it supports or resources that are already in place, as I've just mentioned, or we've enhanced some of those supports, or through new announcements that we made today through our $25 million tourism program, we will continue our engagement with industry leaders and our federal colleagues to find solutions that are needed. On that note, applications are now available for the Canada Emergency Commercial Rent Assistance Program. This program aims to lower rent by 75% to some of the small businesses that have been affected by COVID-19. So if you're looking for an application, you could find it and the criteria associated to the applications on the Canada Mortgage and Housing Corporation's website. That's the CMHC website. So we're all federally, provincially, and communities working very hard to continue to provide the supports that we know that are needed. The residents of our province, they also know the physical challenges that your province is facing. But as a government, we are committed to continue to work with all sectors, all industries to help them get through this tough time in their life as well. We will need them to be there when the province is back on its feet. COVID-19 is one of the largest challenges that we have faced together as a province. The virus is a test of our residents, and so far you're getting a great grade. This time, in a period of COVID-19 and this pandemic, will be one for the history books. So let's let our actions today be the result of a good story tomorrow. So continue to keep your safe distance while remaining social and stay safe. I will now pass it over to Minister Hagee for his comments today.
Thank you very much, Premier. Again, zero, and straight days of zero. It's interesting times where we regard that as a significant sign of success. I'd like to join with my colleagues in mentioning Paramedics Services Week. The first responders we have in this province have shown themselves time and time again to not only do the job, but go well beyond it. We saw that with Snowmageddon at the beginning of what has turned out to be an interesting year, and we've seen that through COVID as well. Coming from an era where paramedicine was in its infancy, I have seen for myself in clinical practice the huge benefit that paramedicine has brought to the management of the acutely sick and ill in pre-hospital care. And building on that, part of my interest in the last 3 years and currently to try and enhance community paramedicine and to look at bringing that level of expertise out into the communities to provide greater benefit to individuals, particularly those seniors who may find it challenging to travel. So a shout out to all of you, a great thanks from me and the department for the work you do. And here's to some interesting times ahead as we see where we can take things together next. From the point of view of current news within healthcare, really the story is continuing ramping up of procedures, diagnostics, lab work, and procedures as inpatients to start to address the backlog. Each regional health authority has been working hard behind the scenes to bring in more in the way of diagnostics such as endoscopies, light tests, and surgeries that are timely. And those will be the ones that are addressed first, and then obviously those with lesser urgency will come to follow on behind. The big factor that's unknown in all this is the issue around capacity. What is the right level of capacity to be able to deal with the further cases that we do at some point, unfortunately, expect to see? The other more immediate pressing thing is around PPE. We had a better week with deliveries last week, but it's still a significant challenge when bearing in mind across the system we go through somewhere between 2,500 and 3,000 gowns every day. So we're talking orders that need to be in the millions to ensure both the ability to go back to a fairly normal level of functioning in the post-COVID era, as well as to be able to meet with surge capacity. So I'm sure there are people out there who would wish we could go faster, but I think one of the messages that we've tried to relay is that we need to take it steadily, hurry slowly, and don't rush it in case we should unfortunately wreck it in the process. So with that, Premier, I don't really have much more to add today, so I'll hand it back to yourself.
Well, thank you, Minister, and I will now turn it over to the media for their questions for today.
Thank you, Premier. For the benefit of our speakers, we have 5 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press *1 until your name has been called. Following this, should time permit, there will be an opportunity for single questions. This call will end at 2:59 p.m. and further questions can be emailed. Our first questions today are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Premier or Dr. Fitzgerald, I'm not sure who wants to answer this, but in terms of the staycation announcement and the tourism support program that was announced today, what level can we begin to see staycations happen in?
Well, from the alert level that's been put in place by public health officials, I mean, we still encourage people on if it's not essential travel within our province. It's not essential travel at this point, but we know that at some point people will want to move around, but we must make sure that when they do that, they just do it safely. So it's measures that would have to be put in place, making sure that the risk assessment that will be done where the appropriate amount of PPE is required. As we get further along into our alert system where restaurants begin to open up and as people move around our province, we must continue to do that safely. As I said earlier, that if indeed we get a spike and we see more positive cases, people can go inside. We can go back to alert level 4, as an example, can go back. But one group that cannot go back are those healthcare workers. So it's about finding the balance. And when we get to the appropriate time when people can move freely, safely around our province, that's the alert. We'll see more movement, I'm guessing, by where we see an alert level 3, but only when people can do it safely.
Okay. In terms of PPE and our pace of reopening with the levels, I know from level 4 to 3, the 28 days was what was announced. We have no indication for level 3 to 2 yet. How much of a factor is the shortage of PPE playing into that?
It's an extremely important factor. In contact tracing, we've done a remarkable job back in March and April in doing proper contact tracing, getting people identified so that we can get, identify the positive cases and slowing the spread. But PPE, making sure that we got the protective equipment available to our healthcare workers and those essential workers is a critical component of where we need to be as we open up our economy. Not only is it just for essential workers, but also we know that many people in the private industry themselves will find themselves competing for this same PPE. So, it's about finding a balance, and we're seeing this in other provinces right now where, they find themselves in a situation where supplies are low. We've always been able to maintain, as Minister Hagee has said so many times, the supply here. But, supplies come in often much lower than we would have ordered. So opening up the economy, PPE is a major discussion, a major part of the decision-making before we move forward.
Thank you. And finally, I know we've asked this weekly at this point. It's one of those hot topics, especially with our
we move forward.
Thank you. And finally, I know we've asked this weekly at this point. It's one of those hot topics.
Trying to work through those multi-second delays.
Thank you.
Our next questions are from Tyler Dunn of VOCM News. Please go ahead.
Thank you. Premier, you talked a little bit about the funding that was announced today for the tourism and hospitality industry. I'm just wondering how much money is available in total through that contingency fund?
Well, we had $200 million in the contingency fund, and one of the things as we make announcements, and there's been a few in recent days about how we support our communities and our residents. We first of all and foremost, we look to the departments. I mean, there's been some reprofiling that will happen internally within the system, and when we can find it there, that's the place that we will go first. And so far, there's a $200 million contingency fund that we'll give an update on soon. But some of the money from the tourism program that we announced today will come from that $200 million contingency fund.
And so the update will also talk about how much money is remaining, or do you know those numbers?
Yeah, no, yeah, for sure. Good question. So I just want to clarify that a little bit. So far, we haven't used much of that money at all because first and foremost, what we do is we look to the federal government to see what level of support we can get from them on this, and we've been successful on a few examples there. Secondly, we look internally within the department themselves because on the expense side, things have changed within the department as a result of this pandemic. So we go there. That's our second stop. And thirdly, we have the $200 billion contingency fund. We haven't used much of that at all yet, and so once we identify what we couldn't find in the department, then the last resort would be the contingency fund.
Thank you. And Dr. Fitzgerald, I was just wondering, is there an update on what kind of changes daycares might undergo during the next alert level?
So we've been having some discussions with the Department of Education and Early Childhood Development, and they've been obviously connecting with their daycare providers. We certainly will be looking at some increase in the number of children who will be able to attend daycare. So right now we have some restrictions on how many children can be in a homeroom in a child care center, and the restrictions on the total number of children that can be in that center overall. And obviously, as we open up and expand businesses, and we're going to have to expand daycare to accommodate. So there will be an increase in the number of children that will be allowed, both in homerooms and in total in a facility.
Thank you.
Our next questions are from Peter Jackson of the Telegram, and if you're directing any questions to Minister Haggie, we've lost the Skype connection, so he still is on the telephone. Go ahead, Peter.
Hi. I do have a question for Mr. Haggie, and that is you talk about PPE and the struggle just within regional health authorities. How is the province going to handle the demand as more and more private clinics and other services open up, given that they don't have any access to PPE either?
That's a good question, Peter. We have worked with private clinics as far as providing PPE for emergency situations is concerned. We have also encouraged them to use virtual consultations wherever appropriate, and they have, by and large, according to our data, done quite well at that. From the point of view of how we go on forward, it really is a challenge. Our backstop has to be a maintenance of emergency services, and our backstop has to be protection of healthcare workers who are on the front line. On top of that, then, it is simply a matter of what extra we have in terms of our ordering. We are putting in orders on a regular basis and have outstanding orders going back to January, which have still not been filled. The challenge is that we cannot find sources of a lot of these things. So the short answer is we manage from week to week. Our orders come in late and light, and we will share them as best we can. I think at some point, though, there will be an expectation as the supply chain stabilizes that the private clinics will go back to their regular sourcing for such equipment. This is a continuous management exercise. I don't have a glib, smart, quick, easy answer. There are lots of irons in the fire, and at the moment, we are managing to increase our capacity within the healthcare system writ large, slowly, week over week. And as long as we can continue to do that, we'll carry on.
Okay, thank you. I also wanted to ask Dr. Fitzgerald, we're supposed to be seeing restaurants open in the new level 3, and people going to restaurants obviously can't wear masks. So what risk does that pose to the waitstaff restaurant?
So with any businesses that are reopening, restaurants included, of course, physical distancing is still very important. And we are recommending that. So that's why restaurants are going to be opening, provided they can maintain that physical distancing. And that, I think, will have to apply to wait staff as well. And there are ways around that. The other thing we have to remember, as we've said before, you have to look at not just the fact that you're interacting, but the intensity of the interaction and the number of people that you're interacting with. So if the intensity of the interaction is of short duration and not incredibly close for an extended period of time, then those interactions have lower risk than if you're in a closed space with someone for an extended period of time. As well, there's the careful hand washing that should be happening on a regular basis. Of course, you're in a restaurant, careful hand washing should be happening regardless. So that's very important as well. So it's physical distancing is important, but there's all those other public health measures that we have to remember as well. And we have been engaging with that sector to ensure that they have the information that they need to make their workplaces safe.
Thank you. I wanted to go back to the fiscal update that was mentioned earlier. Premier, I'm not sure whether you gave a time estimate as for when that update is coming, but I'm wondering if you do give some kind of fiscal update, will the House of Assembly be open in some form to actually address that?
Well, the update, it would not need to be open. There's two things. There's two updates, Peter, that we've been questioning and answering. One is as we close the year at the end of March of 2019, 2020. So that there's been some changes, as the finance minister mentioned last week, because the last 2 weeks, or nearly 3 weeks, I guess, of that fiscal year saw some significant challenges as a result of decreasing in oil prices and the impact of the pandemic both on the financial situation of not only just Newfoundland and Labrador, but really through many countries around the world. So that was our budget. So we'll be in a position now within the next week or a week and a half or so to finish and finalize the fiscal year 2019-2020 and get that information out. But also the $200 million contingency fund that's been put in place that we have permission and is passed within the House of Assembly now, many weeks ago. So this has been in place. This is really to support pandemic efforts. And today, an announcement that I made around tourism, the tourism program, is a result of the pandemic impact on that industry that we all know well and can share many stories of partners within that industry would be severely impacted just because of travel restrictions.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Mr. Cowan, please.
Star one. Operator, are you able to manually open his line?
One moment, please.
Thank you.
Mr. Cowan, your line is now open.
Thank you very much. Not sure why my star ones weren't being registered on the system, but question for Dr. Fitzgerald. A lot of people have been wondering about the 3 people who've been in hospital for quite a while now, weeks and weeks. Are they still testing positive and infectious, or has their body cleared the virus, but they're still dealing with some of the complications that came from having this disease? And at what point would they be considered recovered, and have they actually been?
So, to the best of my knowledge, and I'm not privy to all the case details of every case, that 2 of the 3 people in hospital have tested negative for the virus and are considered recovered. And are in because of other reasons, are remaining in hospital because of other reasons. So with regard to the definition of recovery for hospitalized patients, the definition of recovery is resolution of symptoms plus 2 negative tests at least 24 hours apart.
So looking at the numbers then, does that, because a lot of people have sort of assumed since there are 3 active cases, 3 people in hospital, those are the cases, or are they then considered recovered, and so that would mean there are still 2 people who are at home in isolation still recovering?
So I'd have to be certain of that information, but I think that information came to me just before I came over here today. So I'm thinking that those 2 are actually 2 of the people who are in hospital.
Okay. And I've talked to businesses who want to get ready for an opening that could come as early as June 8th, places like hair salons, for example, who have been scouring the website. There's no specific guidance out for them. They're worried because they're going to need to have time. They might, for example, need extra barriers or, make physical changes to their facilities in order to be able to do things safely. When will public guidance come out for those businesses that are able to open at level 3?
So that guidance is actually being worked on diligently right now by the public health team and others who are involved in that industry, and we hope to have that up in the next day or 2.
Thank you.
Our next questions are from Elizabeth Witt of All Newfoundland, Labrador. Please go ahead.
One moment, please. Your line is now open.
Hi, thanks. My question kind of follows on Peter's. On the COVID website, where businesses are being directed for more information, the alert level changes are often listed as with restrictions or with details to be determined. And I know we've spoken with a few operators who are kind of throwing their hands in the air because they've reached out to the business team that was put together, and they're not being able to get answers. So I'm wondering, when will these determinations be made and the information added to the website?
In the next day or 2.
Okay, perfect. And I was curious, as Newfoundland Labrador enters through these alert levels, there, I assume, is an anticipated greater demand for PPE and testing. And are there any current projections of how much those demands could go up?
Well, it depends on what the operation would be and what the required amount of PPE would be. So this is really what's based the risk assessment that's been done by public health officials and supported with the Business Guidance Committee as well. So we know there will be a demand on PPE, and we're seeing this, right across the country. And it's important now that, as the minister has said, we must have a sufficient stockpile so that we can actually respond. So this is really, I think most people now are getting an understanding of the the challenges that we face when you start reopening up the economy. And watching media reports that have been coming out of other provinces over the weekend, we must remain focused here that in providing that proper balance of making sure we open the economy up, getting the services that people are looking for, do the risk assessment and the impact that would have to be on the PPE that could potentially be required by healthcare workers, essential workers, to respond to an outbreak. So I think people now are getting an understanding, just even based on the questions today, of how you have to juggle, what's required here. But we will be very clear here that we must have a stockpile so that we can respond to protect our healthcare professionals and those that are required the appropriate levels of PPE in the private sector. It's their responsibility to be able to provide that, because you cannot necessarily always depend on a government to actually supply that PPE for you. You have that responsibility to actually effectively and safely put your workers to work and protect not only your workers but the clients that will visit your premises.
Thank you. And this question is for the minister. I was wondering, when was the last time you signed the public health emergency order? And as we go through the pandemic and through these alert levels, do you plan to stop signing it?
The last one, I think, was just around 11 days ago. So I think we're due again this Thursday. All the special measures orders and the authority under those only exists as long as a public health state of emergency is declared. So the last thing to go will be, in my view, the declaration of the public health state of emergency. It's only when Dr. Fitzgerald and her team feel that they require no more special measures orders to safeguard the public health that the state of emergency becomes redundant. So that's one of the last things to do.
Thank you.
Thank you, Minister. We have time left now to take two more questions from each reporter, and then we will end today's call. So our questions will come right now from Kellyanne Roberts of NTV News. Go ahead. Operator, are you able to assist on that call, please?
Ms. Roberts, please press star 1 at this time to proceed with your question.
We'll move on to Tyler Dunn of the OCM News, and we'll come back to Kellyanne. So, Tyler, if you would press star 1, and please go ahead.
Thank you. I was just looking for clarification on the applications that have been denied. Premier, is only 7% of the total applications have not been allowed to enter the province?
Yes. So if I think it was over 3,200 that we've received, or applications that have come in through public health officials, and about 7% of those have been denied.
Okay, thank you.
So we'll go back to Kellyanne Roberts of NTV News. Please go ahead.
Hello?
Hi, Kellyanne. Go ahead.
Oh, perfect. Thank you. I'm wondering where we're at with the essential worker wage top-up. The last we heard, it was with the federal government.
Still with the federal government. If we do our inquiries and feedback and follow up on this, but this essential workers top up is something that we're committed to. Our proposal is up with the federal government, and as I mentioned, this would be a one-time payment. The program expires on July 1st, or July 4th rather, and so that would be the time frame that you would have worked if you're an essential worker up until July 4th. So it's not that the program will expire and you would not get your money, but you would get your money based on the work that you've provided up until July 4th. So it will be a one-time payment, something after July 4th.
Thank you. And Dr. Fitzgerald, we know you speak regularly with other CMOs. I'm wondering, what's the biggest question they've had to you about what they can take from Newfoundland and Labrador and apply to their jurisdictions, knowing that we have done so well in tackling our curve here?
Well, our conversations with the chief medical officers of health and public health officers in other provinces is really a sharing of information. It's just talking about topical subjects and how we're all responding to that. So I don't know that they've had any specific questions for me in particular, but it's really just about us sharing what we're each doing with regard to a particular area, a particular question, and that exchange of information in general. So it's been an incredible place to learn and to exchange ideas. Lots of information that we've gotten from that venue.
Thank you.
The next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi. I'm not sure whether it's decided on the windows between different alert levels. I know we had a 28-day one from 4 to 3. Is there any malleability on that for the next levels? Or are they set in stone as 28 days?
No, so what we've said in the past is that we will be looking at looking at the epidemiology here, epidemiology elsewhere, and deciding, not only what measures we have to do or how we progress through those levels, but also how long it would take us to move from one level to the next. So, there's nothing, it's not set in stone for sure, but it'll be something that we evaluate on a regular basis as we move through the next alert levels.
Okay, and as a follow to that, have you set any thresholds for new cases that'll determine whether you reimpose health orders, or is that being done on a sort of malleable or flexible basis?
So we have a surveillance strategy that we're using as we move forward and move through this, and that surveillance strategy includes looking at the number of cases we have, the R0 or RT, looking at percent positivity in our lab cases, and so there's a lot of information that we will be looking at with that. And in addition to that, we'll be looking at other parameters that will, or indicators that will tell us, about our healthcare system capacity, about our public health system capacity. So all of those things are things we have to consider moving forward, and it's all a part of our ongoing surveillance.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead. Operator, once again, if you could manually open that line, please.
Certainly, one moment, please.
Thank you.
Your line is now open.
Thank you very much. Premier, you said the proposal for the top-up for essential wage earners is with the federal government. Can you provide some more details on what exactly the proposal is? Who exactly would get the money, and how much are we talking about?
Yeah, so there's a definition of what essential workers would be like, and there's a definition that we've used from the Canada Public Health Safety or Public Safety. And so we will use, and it's a broad range of people. It includes, from cab drivers to people that clean facilities, to our healthcare workers, to people that would work in grocery stores. There's a number of people that would be included in our proposal. The federal program, if you remember, was initiated as a result of the $2,000 threshold that was from the CERB program that was announced federally. That was the Canadian Emergency Response Program. And so that was at $2,000 threshold. So then what was happening then, we had a number of people that were providing some essential services to, Canadians. And so it was decided to top that program up to $2,500. And in Newfoundland and Labrador, there were not a lot of people that would have qualified simply because that was at the $15.63 threshold. So it was important then for us to be able to show some support for our healthcare workers. So we've raised that threshold in our proposal up to $3,000. Some other provinces have taken different thresholds. So, it's up there. We'll work with the federal government to get our proposal accepted. So it's at the $3,000 threshold. So anybody that would have made less than $3,000 per month, which up until that 16-week period, which would end on July 4th, would qualify. So that's kind of the extent of the proposal.
And a question for Dr. Fitzgerald. You said before that the restrictions that are in place are to prevent the possibility that we may have asymptomatic people from infecting others. Since we haven't seen any new cases in 17 days, does this mean that there are no asymptomatic people spreading the disease? Wouldn't some of those infected people have started showing up in our testing, for example?
Yeah, so that's a good question. So the thing with asymptomatic people is we don't know where they are. So there may be some asymptomatic people that we don't know about. We don't have a lot of information about how easily asymptomatic people transmit. We know that some of them do. We don't know really what percentage of them do. So there may be that, but there may also be that some people are being very good with self-isolation, and so we're not seeing spread because they're following the guidelines and staying at home. But it is certainly bodes well that we haven't seen any cases coming up in our testing, or we haven't seen people presenting to hospital. That certainly does bode well for us having a low prevalence here in the province.
Thank you.
Our next questions are from Elizabeth Whitten of All Newfoundland, Labrador. Please go ahead.
Well, what I was asking about a moment ago, Minister, you mentioned that signing the public health order, the lifting of the public health order, would be the last thing you did. So I was wondering, was that when a vaccine would be effective and widely used, or would that wouldn't be level 1 though?
Well, the interesting thing is if you look at alert level 1 does have restrictions in it. It's not normal as of, this time last year kind of level. So I think we would need to be looking at that stage as to what the situation was more generally. There are stories about vaccines, but they're still 16 to 18 months out on the very optimistic circumstances. There is little or no evidence yet of a definitive specific treatment for the disease. And I think absent either of those, if there's evidence from around the world that this virus is still prevalent and still cycling around, and certainly that seems to be the case if you look at China now with a third wave, for example, in a different province, it looks as though we're going to have some form of restrictions for some time yet, and a vaccine that works and is widely available and is widely used by people in this province would be the bedrock of that kind of thing. So the longer answer is there. The shorter answer is we would need to keep our state of emergency until such time as we no longer need special measures orders. The only way we can reduce mass gatherings or events like that is around those special measures orders, unless we choose to go a different route through the House of Assembly, for example. So it really is a chicken and egg, and I have no idea what the world will look like from COVID point of view by the time we get to level 1.
Thank you.
If there are no further questions, I'd like to thank the reporters who signed in today. The time for questions has ended, and we will see you again on Wednesday at 2 p.m., 1:30 in most of Labrador. Have a great day.
Thank you.